In this lesson, we're going to take a look at some patient positions. First off, you need to recognize that we put our patients in certain positions as a response to the patient's, to their need. If a patient needs to get better oxygen, then we can put them in better positions to promote better chest expansion, which will help with oxygenation. If we see our patient maybe has a need like to protect their airway because they may throw up, then we can put them in different positions, maybe to sit them up. That way we can prevent aspiration. You also want to put your patients in certain positions for particular procedures. So like in a CT scan, they need to be lying flat. If they have a respiratory issue, they can't lie flat. So we need to use our nursing judgment here, and we can also adjust our patients for comfort as well. But the biggest thing that you can do when you're thinking about your patient's positions is think form and function. If I put my patient in this certain position, what's going to happen to blood flow, position of organs, stuff like that. You can also think about it another way. Let's say you need to do X, Y, or Z for your patient. Which position is going to be best? So let's take a look at those positions. Fowler's position is going to be pretty much your go-to for anything that you're doing for the majority of your patients. What you need to know for this is it's a relative position of the head of the bed in terms of degrees. So starting out with low Fowler's is 15 to 30 degrees. And I know you may be thinking just because they're maybe 15 to 30, somewhere in this range, right, that they're not lying flat, but the patient will feel like they're almost flat. So if your patient is having a hard time breathing, you'd make sure you don't want to put them in this position. Semifowler's is a little bit different. So semifowler's is 30 to 45 degrees in this area. And you're probably going to see patients that have had like abdominal surgeries or those with NG tubes. And sometimes you even want to set them a little bit higher than that. Another one is Fowler's, and this is going to be your go-to for the majority of your patients. This is 45 to 60 degrees in kind of this area right here. The majority of your patients are going to be sitting here. Anything higher than this, like high Fowler's, which is 60 to 90, your patient is probably going to attempt to fall over. This is a great, high Fowler's is really good for patients that need to sit up, but and maybe they can't get out of bed, but this is great to kind of get them in that upper position. Just know that when they get to 90, this can be uncomfortable. But the things that we really want to focus on here are, there are a couple of takeaways. You want to sit your patients up higher if they have a decrease in oxygenation. And the reason you want to do that, let's say your patient is sitting in the 80%. What you want to do is you want to sit them up first. And when you get your patients up, their chest expansion gets better. But that's really to a degree. You can go too far, like we were talking about here with the 90. So that can actually, anything beyond that can increase pressure in the abdomen. So just be aware of that. The other thing you want to think about it is Fowler's and high Fowler's, these two right here, can decrease the likelihood of aspiration because the positions encourage the stomach to empty their contents. But Fowler's isn't for every patient, so we can take a look at some other positions. When we talk about flat types of positions, what we're really talking about is the relation of the back to the back of the patient to the bed. And so when we're talking about supine, which is this guy right here, supine, the patient's back is against the bed. So this is the bed right here. And the front part is exposed. The front parts of their abdomen and the front part of their legs are exposed. Prone is the exact opposite. When your patient is prone, they're lying on their abdomen. So when we talk about flat positions, we're actually talking about that they are 0 degrees at the hips. So this is your bed. This is your patient. This angle right here at the hip is 0 degrees. You can have a patient who is also supine and Fowler's. The first two positions just talk about the relation of the patient's back to the bed. But the thing that you really need to know is that you can use combinations of these. So you can have a patient who is supine and let's say this is 45 degrees. It's probably a little bit higher, but your patient can be supine and Fowler's. So just know that you can combine these. Good old Trendelenburg. A lot of times you'll hear this referred to as being in trend, or hey, we need to put them in trend. Basically, your patient is flat. So this, like right here, you have 0 degrees. But what it tells you is the patient's head in relation to their feet. So standard Trendelenburg, which is this guy. So the feet are above the head, right? And you might hear some older nurses talk about that the position really helps to promote blood flow back to the heart. But the truth is really the only time you're going to do this is if your patient's maybe getting a central line, or if you need to move a heavy patient up in bed. And the reason is because we use gravity to help us move the patient this way. So if you have a heavy patient, you'll grab a couple of nurses and slide them down because you're not working against gravity. So you're going to move their head up in the bed, and then you'll kind of put them back in, whatever position they're in. Reverse Trendelenburg is the opposite. So you're going to have your head above your feet. So this is, again, you've still got 0 degrees here at the hips, but this is for your patient that can't bend at the waist. So let's say you have a patient that comes out of the OR and they can't bend at the waist for whatever reason. This is a great position to put them in. You get the head of the patient way up here to promote chest expansion, like if your patient's having respiratory issues, because all of the organs shift downward. But you're still keeping your patient flat. And so we'll also use this for spinal precaution patients that can't bend or twist. So when you lie them flat, you get the head of the bed up, and it promotes chest expansion, and you don't compromise their spinal position. So let's look at some other less common positions. You're not going to really see these positions unless you're in a specialized area, like let's think OR, L&D, or maybe gynecology. But what you need to know is that these things are going to help you out. So Sims position is basically a side lying position. So this is your bed, and here's your patient. So your patient lies on their side, and they have one leg over the other, and they're usually hugging a pillow. Now, these are great for your, for like maybe your pregnant patients, but it also helps if you need to do things like your good old suppository or an enema, because it allows you to have, it puts the patient in a more comfortable position for access, essentially. Dorsal recumbent is another one of those OR positions, a rare one if you really need to get your patient more comfortable. But basically, your patient is, they're basically lying flat, and their arms are usually above their head, and it relaxes the abdomen. So, but basically what you need to know from this is that they're supine. Now, lithotomy is going to be one of those positions that you're going to see in one of the special areas like L&D, and it's this guy right here. Supine, the legs and hips raised, and it's to better promote access for, or reproductive access for the provider. With patient positioning, we really want to focus on safety. We also focused on patient-centered care. We really use that clinical judgment to put your patient in the best position for you. So let's recap. Make sure you know your different types, and make sure you know what's appropriate. If you have a spinal patient and your orders for high Fowler's, question it, use your judgment. The reason you would want to do that is that spinal patient may not be able to bend. So using your nursing judgment, you can say, hey, this doesn't make sense. So just think about those things. Use positions to best promote priority and encourage safety, which is what we want to think about. If you have an order for a semi-Fowler's and you need to sit your patient up high because they're decompensating, then do it. You can always come back to those things. There's also no one size fits all, and you need to combine them. And every patient's going to have different needs, so make sure you're accommodating for those needs as well. Again, think form and function. Recognize that you have to put your patient in a position that may be a little bit uncomfortable, but when you do it, it's going to make the procedure go more quickly. And as long as you don't risk any of their safety issues, then you're doing right by your patient. That's it for our lesson on patient positioning. Make sure you go check out all the resources attached to this lesson. Now go out and be your best selves today. And as always, happy nursing.